Pertl from RCSI. And Maria's, the title of her presentation is Co-authoring Effective Management of Depression Among Patients with Cancer, and the project is called Enhance, and it's a hybrid systematic review and network meta-analysis. Maria is a lecturer here in the Department of Health Psychology at the School of Population Health in RCSI, and her co-author, who can't be here today, is Gareth Monaghan, who's a member of the Public and Patient Involvement Group for the Enhance project, and he was a co-author on this work that Maria is presenting today. Thank you, Maria.
Hi everyone, thanks so much for having me here today. So I'm going to try and do Gareth justice here. So he's sorry he can't make it today, but hopefully I'll be able to capture all of his points around the process of co-authoring this paper. So the paper was published a couple of months ago in the Journal of Psychosomatic Research, and it has a very long and convoluted title, but it's called The Effective Management of Depression Among Patients with Cancer, which was the ENHANCE acronym for the project. And it was a hybrid systematic review and an attempted network meta-analysis of randomized controlled trials. And I'll get back to why we included the word attempted in the title later on. So I'm going to just talk through the steps that, or the kind of the process that we adopted so that we could co-author this publication together. And I suppose when you think about co-authoring a paper, you probably immediately jump to, what's the process of writing like? But actually, I think fundamentally you have to go back right to the start of the process, because the co-authoring piece doesn't start when you sit down to write the paper. There is a lot that has to be done before that to actually ensure that everyone is involved and has the ability to contribute to the final product, if you like. And that really starts from funding. So funding for PPI, I'm preaching to the converted here, I know, is really, really important to actually facilitate meaningful engagement from the very start to the end. So this was the original research team that submitted the grant application to the Irish Cancer Society and the NCCP, and we were successful in getting funding for the project, for the Enhance project. And this allowed us to recruit 2 PPI co-researchers who were really there from the very start of the project right up until dissemination, and they're still involved. And it allowed us to have the financial support to support their meaningful engagement. And I suppose I need to make the point that I got the funding in 2019, so it's going back a few years. Then I went on maternity leave in 2020, so it was delayed. And then I went on maternity leave again a couple of years later, so it was delayed again. So what was originally a 22-month project, so now this was published in 2025, so it was a long process. And Katie and Gareth, who were our PPI co-researchers, they came on board before the project kicked off, and they're still involved. So that was really, over a prolonged period of time with significant, like 1 year, 2 1-year gaps in between as well. And they've really been key to the success of the project. So, and then the funding also allowed us to recruit research assistants who were also very, very important. So after the funding, I think, is really, really important. But, and this came up in the session this morning as well, training also played a really key role here. So this project involved a systematic review and a qualitative study. And we used a hybrid approach for a systematic review, and we wanted to carry out a network meta-analysis, which they're quite like technical research methods. So the purpose of the review was to investigate which intervention approaches are the most effective in treating depression among patients with cancer specifically. And then the qualitative study part was a focus group study where we were interested in examining the factors that impact on the effective management of depression among patients with cancer in Ireland from the perspective of both patients and healthcare professionals. So there were a number of methods involved, and some of them were very, very technical. So it was really important that the PPI co-researchers felt confident in weighing in to the decisions, that they knew what the methods were, and that they were confident in speaking up about them. So before the first steering group meeting of the project, we held a training session which involved me. I delivered the training session with Katie and Garrett, where we sat down for a couple of hours really, so it was delivered online because it was at the tail end of COVID. And we really went through, what we had outlined in the proposal to the funders, what the methods would involve, so that when it came to the first steering group meeting, that they were confident in knowing exactly what we were planning to do and how we were going to do it. So with the systematic review, there's lots of different steps involved, there's lots of decisions to be made, and it was important that that training took place before the steering group meeting, because the other people who were going to be present there had been involved in actually developing the proposal for the funders. So they had experience of the methods and they had more knowledge about the project. And it was very important that everyone came to the meeting and was kind of on equal footing. So they weren't kind of starting at the back foot. So it had to be bespoke to the project that we wanted to do. And before the first committee meeting. So the aim of that was really to provide training on the specific research methods that we were planning to use, and to also reiterate the unique expertise of PPI. So in that meeting, I would have gone through, I would have kind of given a profile of the whole research team. So we had someone who was very experienced in doing network meta-analysis. We had someone who was experienced in qualitative research design. And like that, it was very important to outline, well, you as the PPI co-researchers, you're bringing unique expertise that nobody else has, so that they knew what they were bringing to the table and that we valued what they had to say. So even though, not other members of the research team had never done a network meta-analysis either. So, just because you don't have experience of one specific aspect of the project, it doesn't mean that you don't have expertise that's really key to the success. So that was really important. And then also to give the time and space to really build relationships, because I think from recollection, both Katie and Garrett voiced interest in the project from, I think it was a Twitter kind of call out at the time. So I'd never met them before. We had no pre-existing relationship at all. So it was really important to get to know one another, get to know our backgrounds, where we were coming from, why we were interested in this, and build those relationships. And that was, it was really crucial. And the fact that they're still all working together many, many years later is I suppose, a testament to that. The next thing I suppose I wanted to highlight was that Katie and Garrett were really an integrated part of the research team. So everyone had an equal standing on the research team. They were invited to every single research team meeting. They were included in all of the emails. So if there were decisions to be made in between steering group meetings, they were included in that process. So there was never any emails that went out that they didn't receive as well. We met online about 4 times a year, but I would have linked in with them regularly throughout, in between meetings as well, and kind of had follow-ups to steering group meetings, or sometimes if there were things, kind of issues or challenges to discuss at a steering group meeting, I might reach out to them beforehand and say, look, this is what we'll be discussing, and just to kind of give them a heads up about it, and especially to kind of support any kind of key decisions so that they were confident going in and speaking up. And I have to say, it was a really, really nice research team, so everyone was very open and collegial, and felt that they were comfortable in sharing and speaking openly and saying, I don't know, I'm not sure about this, or that it was okay to kind of say that they didn't understand something or didn't understand a term. And that was not just the PPI co-researchers, but the researchers themselves as well. So the next thing is having a sense of shared ownership of the project. And so I was very cognizant that Katie and Garrett weren't involved in writing the funding application. So they didn't have a chance initially to say, this is a research idea that, that we should pursue, and this is how we should do it. They were recruited after we got the funding. So now that the seed funding available, which is a really important step, so that you can have that PPI input before you actually apply for the grant. And that's hugely important, but we didn't have that here. So it was really important to give them a sense of ownership of the project, that they weren't brought in as consultants to, this is our project and you can, voice your opinion on it, but that they felt that it was their project as well and that they could shape it. So even though we had outlined what we were going to do and how we were going to do it, it was still up for discussion. And I suppose the key thing that they weighed in on was the design of the systematic review. So the first step we did was to develop the protocol and to submit that for publication. And we had to make key design decisions around that. And they were involved in that process. And they were co-authors on the protocol. There's a QR code there as well if anyone wants to look it up as well. And so they really shaped what we put into that. So when you're doing a systematic review, you outline who your participants are going to be, what interventions you're interested in, what comparison groups you're going to include, and the outcomes of interest. And we had drafted this for the funding application, but we had an opportunity to revisit this and explore this. And I know one of the things that Katie is most proud of is that their input really led us to include complementary and alternative medicine interventions as one of the key intervention groups in the review. And that's something we had been discussing because the review was around looking at the effectiveness of established interventions for depression that are included in clinical guidelines. So we were kind of on the fence, should we include CAM or should we not include CAM? And I remember Katie saying, that when you're diagnosed with cancer, people are coming up to you all the time saying, oh, you should try this and do this, and my neighbour said, that this is effective. And she wanted to be able to say, thanks very much, but, actually the research evidence doesn't support that, or it does support that. And that's as important to have that around alternative interventions as it is around the psychotherapy or medication and so on. So no matter what the intervention is, you want to be able to draw on evidence. And she was saying that, some people, might find complementary and alternative medication or interventions very effective, and other people mightn't want to go down that route. But either way, you need to know the evidence. So it's really important that that is included. And I know she's very proud of the fact that that really shaped the protocol. The next point then is around opportunities to input into all outputs. And I suppose it's not just about writing the paper, but if you think about the process, that, all of the things that you do before you actually write the paper, most of the time you'll present the results at conferences or you'll discuss them in group meetings beforehand. And those conference presentations can sometimes kind of change your thinking around it and shape the results. And Katie and Garrett played a really key role in this and helped us to make sense of the results. One of the key, outcomes from it was around the risk of bias of the studies that we included. So we reviewed we identified 70 randomized control trials that evaluated interventions for depression. And our findings indicated that of those 70 trials, only one trial had a low risk of bias. And that was hugely disappointing for us because what we had wanted to do with this network meta-analysis was to compare the effectiveness of lots of different intervention approaches and see which ones are the most effective. But we felt we couldn't do that because the quality of the studies was too poor. And we felt that we had a duty to present reliable research evidence. And when the studies that you're basing your conclusions on aren't reliable, then you can't do that. And I felt terrible, actually, as the PI of the project, that I wasn't able to deliver on one of the key objectives of the study, to the funders and to patients. So it was really disappointing, if you like. And Katie and Garrett helped me to kind of reframe that and say, well, actually what you're doing here, what you found here is equally important. You can't answer the question you set out to do, but you're making a really important contribution here. So what we're saying is that we need better research. This is really important for people to know. And the risk of bias, because we were going on then to present the study in the qualitative piece and get feedback from patients and healthcare professionals, communicating that in a way that was, that made sense to everyone. It's very technical. The risk of bias assessment can be very technical. It has a number of domains. And Katie really helped to shape how we presented that. So she came up with this great analogy of the sieve, that using a risk of bias tool is like applying a sieve to the research. So it allows you to strain out the studies that have concerns or have a high risk of bias. So you're only left with those green balls there. So you're left with the studies that have a low risk of bias. And then you do the analysis, including all the studies, and then only those that have low risk of bias. And if the results are different, then it suggests that the results are being skewed by the studies that have a low risk of bias. And I love that analogy, and I've used it, or the metaphor, and I've used it in every single presentation that I have given at every conference on the systematic review since, because it just makes intuitive sense. And it really highlighted why we then couldn't carry out the analysis. So that's why the attempted is in the title there, because we only had one green ball, and you can't compare one ball to itself, so it made no sense. But we wanted, and again, this was Katie and Garrett really argued for including attempted in the title, because if we had just framed it as a systematic review, then the key point of the whole study would have been lost, the fact that the data isn't good enough to be included, and maybe then only people who were interested in the specific area would have read the paper rather than people who were interested in the methods themselves. So they really helped to communicate how we presented the findings in the paper and in every output from the study. And I suppose, I think a lot of the time PPI contributors are kind of described as cheerleaders. And I don't like that, that metaphor, because it implies that, they're standing at the sidelines cheering you on while you do your thing. And that's really not what happened here. So they're really more like coaches, because they're involved in strategizing. They're involved in identifying the kind of strengths and weaknesses and planning of it. Yes, they're cheering you on, but they're also part of the process. They're not just letting, make you do your thing and just, telling you to keep going. They're really involved in it, and they really helped to frame how we presented the results. Finally, in terms of, just kind of continuing on that point, in terms of actually writing the paper. So it wasn't just about, sitting down to write the paper where they shaped it, but it was in, giving them opportunities or having opportunities to input into every single output that related to the paper. So they would have reviewed every abstract submission for conferences. They would have reviewed, similar to the last speaker, I drafted the paper, and they would have given feedback on that. And, it was very technical, very long, and there would have been lots of different iterations of it, but they were so good in terms of actually sitting down and meaningfully contributing to that and changing the language. So because it was a little controversial, lots of systematic reviews synthesize anyway, despite having all studies that are high risk of bias or very few that have low risk of bias. And we took quite a controversial step in not synthesizing it. And we were kind of cognizant that it was a bit, we were criticizing other people's work in putting this out there. So then, sometimes there was a bit of toing and froing around, are we saying this too strongly? And they were like, no, this is important. These studies have been carried out. There was nearly 7,000 people with cancer who took part in the RCTs that we reviewed. And their point was, these people gave up their time to take part in these studies, and the research wasn't of a high enough standard. So, you have to be strong in how you present it. And so it wasn't just the conferences, the paper, but also they would have reviewed the letter to the editor when we're submitting the paper in the first place. And then, sorry, I'm out of time. We wrote a blog post on the paper as well, and we're presenting it next week at an Irish Cancer Society webinar. And then finally, just 2 weeks ago, we found out by chance just that the paper was actually featured in an editorial in the Journal of Psychosomatic Research. And the final line of that editorial is that this work exemplifies the kind of critical, methodologically rigorous synthesis that can reshape both the research agenda and clinical practice in years to come. And it's really funny, it really resonated with me, because that's actually pretty much word for word what Katie and Garrett had been saying to me for months previously, and it was really nice to actually see it in an academic publication. So thanks very much.